Good morning, everyone, and welcome to part 2 of today's class of Scalp Acupuncture with Dr. Liangxi Zheng. Today's webinar is recorded and presented by Lotus Institute of Integrative Medicine. Here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers,
Recording in progress.
700 courses, and 3,000 hours of continuing education. Housekeeping, before we get started, today's webinar is going to run from 9 a.m. to 6 p.m. We'll have a 1-hour lunch break and a few breaks in the morning and in the afternoon. Dr. Zheng will let you know when those breaks are. Lecture notes. The lecture notes are currently available for download. They are the same notes from yesterday's part 1 class. So if you already have the lecture notes downloaded, you do not need to re-download the notes. But if you want a fresh copy, you are more than welcome to download it from our course access page, the chat room. Please be sure to set your chat room to everyone so that everyone can see what you are typing. By default, it is only set to the panelists. So that means Dr. Zheng, the speaker, and myself, only we can see it as we are hosting the class. So once again, be sure to set it to everyone, or if you have an older version of Zoom, it is all panelists and attendees. Okay, and the quiz for today's class will be available tomorrow. I will send an email out when that is ready, and the video replay will also be available tomorrow on Monday. And an email will be sent out when that is ready as well. Okay, let's get started with today's webinar and welcome Dr. Zheng. We are happy to have you back with us today, Dr. Zheng, for part 2. And we are scheduled to learn effective treatments for stroke, pain, neurological conditions, and trauma. Out of curiosity, how many attendees did not attend yesterday's webinar, which was part 1? If you missed part 1 of this class, you may be lost in today's material because you're joining us halfway. We do recommend that you continue with part 1's class at a later time, for which a video course will be available next week. To keep the class organized and fair for everyone, and if there are any questions about what was covered in yesterday's part 1 class, please refer to the video recording from that class for the answer. There's still so much to go over in today's class, so let's go ahead and welcome Dr. Zheng. Dr. Zheng is a graduate of the Chengdu University of Traditional Chinese Medicine. He specializes in scalp acupuncture, which is used for treating stroke, pain, neurological conditions, and trauma. All right, let's go ahead and welcome Dr. Zheng. Dr. Zheng, you can go ahead and share your PowerPoint now and take over the webinar.
Thank you. Thank you, everybody. So today we will continue.
Oh, Dr. Zheng, before you take over, I just wanted to make one more announcement. For all those that attended yesterday, thank you for your patience as we navigated through a few technical issues. We wanted all of you to know that we do prep multiple times actually for the webinar, but sometimes when the event is live and in progress, things do not go as planned. So again, thank you so much for your patience and understanding. Also, the lecture notes. You may notice that the handout is different from the slides that Dr. Zheng is sharing on his screen. We do ask that people refrain from taking screenshots out of respect for the speaker's content. He has prepared the handout specifically for you to use and take your own notes. Every speaker has their own way of teaching, and traditional speakers like Dr. Zhang and Dr. Richard Tan too, they feel that taking your own notes is the best way to remember the material and learn. So please take your own notes and do not take screenshots of the webinar. Dr. Zhang does speak slowly, so it gives you time to write down what you need to. But in case you miss anything, you can always review today's class in the video replay, which will be available tomorrow. Okay, so Dr. Zhang, go ahead and take over now.
Okay, thank you. So thank you everybody come to study. Now we are continue and then learn about the scalp acupuncture. Yesterday we introduced about the forehead area and the vertex area. Today, we are continue going to temporal area. So temporal area, so usually have two lines. Is called MS10. MS10. So the whole name is interior temporal line. So another MS11. So we use MS10 or MS11, the two words, easy to remember. So you, even though these two words, you need to read the whole name, it's difficult. Okay, now we go to see the picture. So this is on the temporal area. So there have two lines. One is for gallbladder 4 to gallbladder 6. This is in the gallbladder channel. You can see the front this line, gallbladder 4 to gallbladder 6. Second line is lower one, is from gallbladder 7 to gallbladder 8. So each line have left side or right side, both. So that means MS10. So there are two lines. MS11, there are two lines. This is about the temporal area. So the two lines, so first we see MS10. MS10. So the line local in the here on the temple is part of GB channel. Is on the GB channel. So from GB4 to GB6, from GB4 to GB6, follow the GB channel. So the GB channel, so from here flow go down. So this channel from 4 to 6, 4 to 6. So the qi and the blood flow is from the lower number to higher number. So it's from 4 to 6. So this is about location. For indication, so MS10, what is useful? So in the clinic, MS10, so in the side area, usually use Shaoyang headache. And the side headache, migraine headache. In the clinic, so the migraine headache, side headache, Shaoyang headache, so many, very often in the clinic. Very often in the clinic. Before no acupuncture, no scalp acupuncture, the patient is so sad. Only take a painkiller. Only take a painkiller. Before we talk about it, if you continue taking, you need to increase dosage. You need to change in the medicine, or you need to increase another medicine. Life is miserable. Life is miserable. But now we have scalp acupuncture. We have the body acupuncture. So we can treat this headache. This headache. So usually we use MS10 plus 太阳 gallbladder 20 三焦 23 or 三焦 5. So then we can plus the liver 2. This is for headache. This is very useful. Very useful. Some doctors so sometimes plus gallbladder 8. Gallbladder 8. So this is all okay. But for this headache, so even though you treat about a few weeks, headache is gone, but still need a tune-up. You need to tell the patient. You still need a tune-up. So why you need to tell patient? So if you don't tell patient, so the patient stop the treatment. So take about a few months, the pain come back. The patient think you don't care this disease. You don't care this disease. So the patient is not happy. So everyone in America, everyone want to treat the disease right away. If you cannot right away, you need to tell the patient. You see, this patient get the treatment, the pain can gone. Just a few weeks, the pain can quickly gone. But need to lump. If you don't do this, maybe take about a few months or half year, the pain can come back. Pain can come back, so you need to treat a more longer time compare first time. So if tune-up can keep this good condition stable, last more longer. So some people ask me, Dr. Zheng, how long we can give this patient a tune-up? How often we need to ask a patient coming to the tune-up? Okay. So if the patient, this pain is beginner, not so severe, few weeks is gone, tune-up. So you may be once 1 month, keep about a half year. Then do evaluation. In the half year, the patient don't have any irregular sensation and tense. Some pain flare up early stage, just feel tense, just feel tight the skin. If you don't have this any symptom, you can stop. You can stop. But if this is long time, is severe migraine headache, side headache. So for the tulip, the time, even though no pain tulip, the time should be once 2 weeks. Once 2 weeks. Then half year to evaluation. Half year to evaluation is continue to once 2 weeks or continue to once half year. So every case is different. So this is in a clinic. Doctor, you should be manager. Manager according to different case, different patient. You tell the patient your treatment plan. Treatment plan. So the patient is very happy. Happy to this. This is the first one for the headache. We can choose MS-10. Second, we can do motor aphasia. Motor aphasia. The patient sometimes due to different disease, due to stroke, due to Parkinson's disease, due to multiple sclerosis, and due to ALS, and so on. So many diseases. You have motor aphasia problem, look like a stroke. The people cannot speaking. So we can choose this point treatment. So if some disease feel speak and start to weak, look like before. So some people ask me, so for the ALS, for the treatment. So, you know, ALS treatment, the early stage don't have so many symptoms, just weak, speak just a little bit difficult. The disease is so smart. You come your body, you have high fever, strong cough, and some very simple, very easy to see symptom. Your body should be know how to do. But the AAS and go to your body, you feel nothing. Feel nothing. When you know this disease, so almost turn down you. Almost turn down you. So cause your whole body paralysis. You can see the skin. You can see the skins and shaking. This is severe. If you go to later stage, everyone treat is difficult. For the facial paralysis, look like in the ALS, in the multiple sclerosis, early stage, just very mild, we are speaking little weak or difficult. During this time, we need to treat. So usually we treat plus MS6 and Ren 23 and heart 5. MX6, this is for motor disorder. So this is motor aphasia. It's the same things. Then we do Ren 23. We do heart 5. Can treat about motor aphasia. So look like this disease, motor aphasia. So motor aphasia, so paralysis, treat more early. So can make the patient back. So you don't treat, the paralysis continue going. So should be rarely cause patient lose speech. But if you give treatment, so the patient slowly come back. I remember I treated this ALS when she coming, she hard to speech, but it's not severe. It's not severe. But when the treatment going, speech is back normal. Once she stop the treatment, it's hard to speech is come back. So this is very clear. See, the acupuncture or scalp acupuncture give patient treatment. The result. So look like this chronic disease don't look like a high fever, like strong cough. You can get the result right away. This chronic disease, hard to treat disease, usually need time. Time can prove your treatment is correct. So another, this is motor aphasia. 3, facial paralysis. Bear's paralysis. Bear's paralysis usually is local nervous paralysis. So cause the face paralysis. So acupuncture treat facial paralysis have good result, very good result. Before we talk about this, best window is half year. Longer maybe 1 year. Over 1 year, 2 years, still can some improve. But over 2 years, very, very hard. Very hard. So to bear paralysis in the early stage, so best don't choose electricity. So electricity causes the trembling, causes the stimulation. Compare you use the hands to the leader. Everybody can try. Hands to the leader. It's more gentle. It's more gentle. It's more soft and comfortable. So electricity to the stimulation is continue, is more stronger, no stop time. You do hands, you do sometimes you stop. So for early stage, so the nervous during and the swollen inflammation, the nervous outside, the outside look like a skin, the cover. Is have inflammation, have swollen, but if strong stimulation should be cause the nervous rarely injury, cause permanent damage. For this, remember, do the paralysis, facial paralysis, early stage, don't use electricity. Some people ask me, Dr. Zheng, how long is early? Good question. Before they still talk, how long is early? Usually, early stage, usually about 2 or 3 weeks. When the disease fly up to 2 or 3 weeks. This is early stage. During this time, you just use your hands. Just use the hands for the scalp acupuncture. So most patient recover. Most patient facial paralysis recover in 1 to 3 weeks. Quickly, about 1 week recover. Longer, about 3 weeks recover bad. That means some people say, Dr. Zheng, so I saw some patient treat a long time and still not recover. Yes, yes. So have one this situation, if this patient don't get a good treatment, so look like get a facial paralysis, go to see another doctor, say different doctor, say something. Don't get a good acupuncture or Chinese medicine treatment. The disease should be last longer. But some people, some patients say, come to see me, say, I have this paralysis half year. I see acupuncture doctor before, but still not recover. Yeah. Yeah, you see about acupuncture treatment quickly about 1 week to 3 weeks. But this patient is, I see acupuncture doctor half year, but still not recover. Okay, so you see the acupuncture doctor. So, but acupuncture doctor, the technique is different. Technique is different. So maybe give you diagnosis differentiation not correct. Everybody know. So Chinese medicine treatment, one diagnosis, second differentiation, what kinds type of the disease. Don't make the good type look like when heat, when damp, and when cold. So different type. Maybe the doctor choose the type is not correct. Then affect the treatment is not correct. So then lasted about half year. So I make this patient face back because and she treat half year. I try to make it back. I almost spend about half year the face back. So compare your original get treatment. It's hard. It's easier. It's easier. Another still have very small case. This small case, it means the inflammation, the virus, the disease, and the damage, really damage the nerves. Even though your diagnosis is correct, even though your differentiation is correct, even though your acupuncture points is correct, but the nervous damage, even though every treatment is perfect, but the nervous was damaged. So this patient, any treatment cannot recover. Any treatment cannot recover. So this case in the clinic is very, very few. So you have this case, you usually have a tongue, the patient feel tongue, the taste is changed, is different. Tongue sometimes feel numbness. So if you have this symptom, you know, this case recover is hard. We don't say cannot totally recover, but we know this patient recover may be slowly or hard or difficult. This is paralysis. So what kinds of points we usually use? Look like stomach 4, stomach 6. Usually we do stomach 4 to stomach 6. Or do stomach 4 to stomach 7. 三焦 17. Larger intestine 4 and liver 3. 太阳 you paralysis on the head. Sometimes the patient paralysis just on their face. Sometimes go to the head. If paralysis go to the head, you need plus stomach 8. And gallbladder 14. And the yin tang and MS1. So most facial paralysis patients in the clinic all can recover. Western medicine don't give any treatment, just give some prednisone or cortisone or some make the inflammation better. But it's not really help. Really help is acupuncture. So for disease in the mouth, MS10, so can treat some disease in the mouth, cause mouth heat and mouth ulcer. But every people we need to know, we can see the mouth heat can cause different reason. And mouth ulcer still can cause so many reasons, cause due to so many reasons. But the MS10 we treat this disease usually is due to 瘙痒 fire and heat. 瘙痒 fire and heat. So in the clinical mouth ulcer, so some take vitamin B. Sometimes use some herb, clean heat treated ulcer. But if due to 瘙痒 fire heat, it's not easy to cure. It's not easy to cure. Most the patient have ulcers, so just the short time get treatment can cure, just 1 week or 2 weeks. I saw one ulcer, mouth ulcer, is over 1 year. Over 1 year. This is very hard to treat. But I checked this patient. This patient working in the Utah. She is Utah teacher. The working is so stressed, and she always have so many heat. Always have so many heat. So for this, I think this is due to 瘙痒 heat. 瘙痒 heat. We use MS10 and the stomach 7. MS10, stomach 7. So, and gallbladder 44. And the 三焦 5. 三焦 5. So, and the gallbladder 40. So, plus the larger intestine 11. Give this patient treatment. Give patient treatment. Then inside, I put some 清代 the herb, just few, or 黄连 few. So get the treatment about 2 or 3 weeks. You can see the ulcer smaller. Ulcer smaller. Treat about close about 2 months. The ulcer close. Close. So this means this disease, Chinese medicine think is 瘙痒 heat, right? But for Western medicine, actually, is due to nervous function problem. Nervous function problem is so tense, because local nutrition is different. Nutrition is different because the nervous tense. So for this, we can use MS10 plus body acupuncture points give treatment. This is first MS10. How to treat? So they treat, we choose 1, so 1 to 1.5 寸. So from GB4 to GB6. From upper go down, upper parts go down. From GB4 to GB6, follow a GB channel. Go down. Go down. This is MS10. So next one is MS11. MS11. First, we see the location. MS11 still a part of the GB channel. So, and going from GB8 to GB7. So, against the GB channel. So the going is from this side, stairs GB8 to GB7. Go up, go down, up, go down. This is MS. MS11 two line before we talk about. What do this guy do? MS11. What do this guy do? What kinds of job this guy do? So this is can treat many disease. We take a look. First, dizziness, vertigo. In the clinic, so many people have mild dizziness, vertigo. Mild dizziness, mild vertigo. So dizziness, vertigo may be caused by the ear, may be caused by the high blood pressure, may be caused by the low blood pressure, may be by these people body weak, maybe by another disease. So for if having the dizziness, vertigo, we can choose MS11. MS11. So look like dizziness, we usually plus MS5. 三焦 21, gallbladder 36, or liver 3. For the dizziness, vertigo. Second, for deafness. For deafness, so we need to see what kinds of deafness. Some people, even though deliver coming in a baby, is deafness. Deafness. This is treated is hard. This is treated is hard. But we know treating this deafness for acupuncture body have good points is do 15 or do 16. This is can treat deafness. Even the people, children have deafness, then the children cannot speak. Because first, the baby should be can hear some information and stay the brain. Then can speak. If deaf, so no information go to the brain, cannot speak. Cannot speak. So for this treatment, so before we use do 15 or do 16 treat this kind of disease, have a result. But for the result and the dangerous, is more result, is more dangerous. If you want to get more good result, you should be have high dangerous. That means if you do more deep acupuncture, you do 15, do 16, you do more deep, it's more dangerous. It's more dangerous. Because this point, the inside, this is called life center. Control your breath, control your heart beat. If you touch, should be cause the people quickly die. So, but if we use MS-11, it's safe. It's safe. But the result, compare result, don't look like so. Do 15 or do 16 for the baby is more result. This deafness is good for due to explosion. So it's high, larger noise cause the listening is dropped down. Listening is dropped down. Hearing is dropped down. For this deafness, MS-11. For the ear issue, this is good. Usually we plus small intestine 19, gallbladder 2. Before we talk about do 15, do 16, and heart 5. Treated deafness. Deafness. But some people say, Dr. Zheng, so for the older people, slowly, hearing is dropped down. About this point is good for? Yes. Yes. This is a good question. Good question. So in the clinic, we see not totally deafness, but the hearing is slowly drop down for the old people. Cat the qi drop down, the hearing drop down. For this case, hearing loss treatment is wonderful. Treatment is wonderful. So you treat one, get one good result. For the old people, if you give a treat, can stop the hearing loss continue. For big noise called nervous injury causing hearing drop down, you use this group points give treatment. Good result. Good result. So everybody in the clinic can try. So scalp acupuncture MS11 plus these points for the deafness. Deafness, and the most we treat is hearing loss. Not totally deafness, but start to loss. So this is second. 3, tinnitus. Tinnitus in the clinic, so many tinnitus. Different noise. But I said, treat the tinnitus earlier. Don't wait. Don't let the nerves get permanent damage. Treat earlier tinnitus, so most patient can recover. Most patient can recover. So tinnitus, so we can do 三焦21, gallbladder 2, small intestine 19, 三焦 5, MS 5, treat tinnitus. Another, we can use migraine headache. Migraine headache, so look like as before. So because close the side head, close side head. So we can use this treatment. So look like plus stomach 7, stomach 8, 三焦 5, 印堂 gallbladder 8. So this is can use about this. Another for Meniere's disease, we take 10 minutes. Oh, this is don't take, we continue. So for Meniere's disease, okay. So the Meniere's disease, you can see, so is in the ear. So the in the ear get disorder. So the patient fear and dizziness, vertigo, and fear pain, and hearing loss. So this disease usually happens in the young people, mostly in the women. So if disease get worse, can cause people nausea. You can see the people say dizzy, and vertigo, and nausea. So for this case, you see the young people. This is Meniere's disease. So the disease always fly up, fly up. So for this disease treat, we can use scalp acupuncture. Acupuncture treat this disease have very good result. So look like MS11, MS1, MS5. And the 太阳 small intestine 19, gallbladder 2, 三焦 21, gallbladder 12. So all these points we can treat Meniere's disease. If a patient feel nausea, so if cause this issue, we need a plus REN 12. We need plus REN 12. So for this case, acupuncture or Chinese medicine give treatment can quickly stop. But then the patient should be take a rest. Take a rest. So then get a treatment can quickly recover. Don't have cause any issue. But if this disease continue, maybe cause hearing loss. So treat the disease earlier. Treat the disease on a clinic. So this is for everybody. It's good. It's good. So method, how to do these points. Do these points is steer from up, go down, up, go down. So from GBA, GBA to GB7, against the channel. Channel is flow is go there, go up, but you treat me is go down, go down against the GB channel, against GB channel. This is about temporal area, temporal area. So within about 2 lines. So 10 or 11, each for different disease, So now we go to last one area. Last one area is called Occipital area, in the back, in the head back. We see this picture. So Occipital area, there are 3 lines in the Occipital area. So you see MS 12, MS 13, MS 14, 3 lines in this area. So first, you see, first we go to see MS 12. So MS12 is called upper middle line of occiput. So this line is a part of Du channel. The location is on the Du channel. Is from the Du 17 to Du 18. So how to find this channel? So everybody can use your hands. You feel your back. So you can feel the bone is up. Everybody try to touch your back. So you feel your back have the up the area. So this is called occiput protuberance. Occiput protuberance. Yeah. Everybody can touch here. Touch here. You can feel. So occiput protuberance. Protuberance. Just up over the protuberance. This is Du 17. From the bone up, continue go up to Du 18. To Du 18. So this is MS12. MS12. So this is very easy. Very easy. You just touch the bone up. You bone up. You can feel apex here. So then go up. This is MS12. So MS12 what do MS12 this guy do? This guy is used to treat eyes disease and the spine disease because it's on the Du channel. So we treat spine disease. So for treat the eyes disease, so later MS 13 we talk together. For the eyes disease, we can choose gallbladder first. Stomach first. 球后太阳 gallbladder 20 treat the eyes disease. We talk about MS 13 together. So second, we need to use spinal cord problem because this is Du channel. So we treat this point, can treat spinal cord some disease. Look like a cervical disease. The pain, stiff, tightness, feel tight. For knees, we can use. Look like some patient say, my hands is stiff. My hands stiff. My hands, my arm feel numbness. My arm feel weakness. So for this, we can treatment. We can give patient a treatment. We can give patient a treatment. So if some people say, I have the disc bulging. I have the spine space narrow. I have the spine the pain. Yeah, this is can use for treat about this problem. So some people say, so the patient have disc bulging is working or not? Yes, it's working. It's working. So, so, but the treatment inside have so many technique. So many technique. Before I talk about the one patient, so disc bulging and get the surgery. But after surgery, so he said still feel pain, no change. Then he go to see the doctor again, surgeon doctor. The doctor say the surgery is 100% wonderful, 100% wonderful. Then he said, why I still have pain? The doctor said, pain is due to after surgery. You have scar tissue. It's due to scar tissue cause the problem. So this is when the patient don't trust the West doctor. So he said, I don't know, is disc bulging is take out or not out, but then my pain still there. My pain still there. In the clinic, I treat so many disc bulging patients. So many disc bulging patients. So if you have the pain, stiff, tight, on the neck, or some patient is on the neck, on the arm, on the shoulder, on the hands. This is due to the cervical problem. For lower limb, leg, this is due to low back issue. Low back issue. So for this all issue, we can use MS-12. MS-12. So before I treat about the disc bulging, disc bulging the patient. So you get a disc bulging, even though the patient want to do surgery, insurance need a check. Insurance need a check. So the patient say, I have pain, I have some numbness, I have some weakness. Is due to disc bulging. Insurance say, you have disc bulging, yes, but it's not reach the surgery, the standard cannot approve. Even though the patient want to do, but the insurance say you don't reach the standard. So that means to surgery have surgery design. You need to send a picture, you need to send an application, get insurance approved. So for this, many patients, so many bad pain is there, numbness is there, every symptom is there. What we can do? Acupuncture. Many patients come get acupuncture, feel release, get a release. But some scheduled surgery. I have a few patients scheduled the surgery, get insurance approved. Yes, yes, you meet the standard. I approve you do surgery. Approve you do surgery. But then the patient is scared to the surgery. Why scared to the surgery? Before I saw one patient after surgery, paralysis. Paralysis. So come see me is in a wheelchair. So in a hospital, do the surgery cause the woman paralysis. Her husband is so angry. Once talk to hospital is so angry. So she said, so Dr. Zheng, you good treat like disc bulging. So can you treat about the surgery paralysis? About the surgery paralysis, I say no. If you don't do surgery, your disc bulging, I can help you. But you after surgery cause the damage, cannot. So then go back. So the many patient schedule the surgery, just scared to the surgery, worry cause paralysis. So then get acupuncture treatment, then cure. Then the patient call the hospital cancel the surgery. So that means the scalp acupuncture or acupuncture is good for spinal cord problem disease. Spinal cord problem disease. So for the cervical parts, we can pass Xinshi. This is extra points. Many students ask, where is Xinshi? Where is Xinshi? Xinshi in the C3 to C5, between C3 or C5, the center, laterally 1.5 trim. On the C3 or C5, this line is either laterally 1.5 trim. Then this line, you check where is tender, where is point. This is extra points. Each side have. You see, so I checked the C3, C3 left side is on the the C3, right side is C4. Is it different? I say yes. According to you check, where is tender, where is points. Maybe both sides in this C4, C5, maybe both sides in C3. Maybe this is C3, maybe this is C5. It's different. Different. So since we need to use small intestine 3. These are the points. These are the points. Some doctor like choose and UB60, UB62. So some doctors say, it goes, it's so long, pull the qi down, making the qi go up, making the qi strong move. Choose 60 or 62. This is a different doctor experience. Another Jiaji. Jiaji points, we do disease side. We do disease side. So for the low back, for the lumbar disease, pain, stiff, numbness, we can use the UB23, UB32, UB50, or low back Jiaji. Low back Jiaji treatment. So now I tell everybody. So for use the scalp acupuncture, use the body acupuncture, treat disc bulging, have very, very good result. Everybody in the clinic can try about this. But some people say even the disc bulging, the patient severe pain, the patient cannot tolerate. Well, so for this, we need a manager about the disc bulging. The surgery standard. Even the patient very painful can tolerate, he can go to do surgery. He can go to do surgery. So you can tolerate, can try acupuncture. It's okay. We don't ask a patient the head to do acupuncture treatment. No. We just give patient a suggest. Because acupuncture treatment reduce the pain, usually need 1 more week. So pain and slowly drop down. Another, you see the picture. If over 50%, over 60% press the nerves. So maybe do the surgery. even lower 60 or lower 50, hurt and nervous, you may be keep acupuncture treatment. Keep acupuncture treatment. So this is MS12. How to do? You do MS12, give strong stimulation, make the qi flow. You can do small intestine 3 or do UB60 or 62, make the qi flow. Make the qi flow. So can help the treatment. Can help the treatment. So in the clinic, so you use about this group treat this bulging. Very good result. This bulging can fly up, even though the patient get a surgery. So about half year, about 1 year, 2 year, the disease can fly up. So once I go to the student's clinic as supervisor, one patient come get the treatment, she cry. I say, why you cry? She said, I have disc bulging. I just get a surgery 2 years, but now fly up. So the doctor asked me to do the surgery again. You see? Yeah. Some people say, surgery again, you can do surgery again. Okay. If you do surgery again, they happen again. How to do? The disc bulging cannot just one time done. I saw one patient working is Boeing airline company. He's engineer. He disc bulging get 7 times surgery. After 7 times surgery, so he is hard to walk. It's hard to walk. But the acupuncture treatment, the pain and symptom is gone. Maybe half year, maybe 1 year, come back. Yeah, it's possible. No people can guarantee one treatment cure and then not come back. No people can guarantee. So half year, 1 year, come back. Come back is easy. You come to clinic, I give you treatment fix. Fix. You don't lose nothing. You fly up 2 times, 3 times, 4 times. You just come get a treatment. You don't lose nothing. If surgery is totally different. Here, I try to let every people know how to improve everybody clinic. In a clinic, you can help lots of patients, make everybody life is better. Yeah, you see, get a surgery cause paralysis. This is your family member. This is you friends. It's so sad. This is why. So his husband is angry. He's very angry. So this is MS12. We can use to treat cervical disease, lumbar disease. What kind of cervical disease? What kind of lumbar disease? We talk too much. Next one, we go to MS13. So MS13 is on the side. We can see meter. You see the meter is 12. Its side, you see side about 0.5 寸. Each side, so is from the 217 to 218. Each side have half寸. Half寸have one die. Same longer. Same longer. Just side. Half寸. So this is not this is not on the channel. This is no channel. This is no channel. So what can use? So what can do for this guy? So this guy is often applied to treat eyes disease. Look like MS12, the parts. Treat eyes disease. So what kinds of eyes disease? What kinds of eyes disease? So look like short sign, far sign. This is can use for about these kinds. So, but for short sign, usually treat in the children, in the middle school, high school students. After treatment, usually make the person's eyes is more bright. So you see the number, check the eyes sign, you see the number.
Dr. Zheng?
Yes.
Can you change the slide to slide MS13?
MS13.
Yes.
This one?
MS13. So I think you're on MS12. Yeah, there you go.
Oh, okay. Okay, thank you. So make the eyes more bright. So we can use look like MS13, MS12, MS5, MS2, plus UB1, gallbladder 20, UB18. UB18. But you see, for the sure sign have good result? The answer is yes. But after the treatment, you cannot always read the book. Always read the book. After the treatment, you should be see the mountain far away place, see the ocean, see the very far the tree. You cannot always stay and take a look at the book. So even after treat, so then your eyes see very far, you can get permanent improved. But even though you get a treatment, you still always read the book. You always play, always see the computer. No. Result is very short. Result is very short. So most of the people treat this in the summer break or winter break. Winter break. This is have good result. Have good result. So another for early cautery. So cautery, we know, go to later stage, need to do the surgery. Need to do the surgery. And with the age, so your lens is cloudy. You cannot see outside. So whether the doctor suggests take vitamin A or vitamin E, can help slow down the cataract they develop. But if we use scalp acupuncture, can improve the eyes local condition, get more qi and more blood. Why you get this problem? Because local don't get enough qi and blood. If young people have this, young people don't have enough qi and blood. But the older people don't have enough qi and blood. So for this, we can use MS13, MS12, and go blood 20, and UB1, UB2, and stomach 1. Give treatment. So for this, if treated earlier, can stop the disease get worse. So this is have good result. But you can, some people say, I can take vitamin A or vitamin E. Yeah, this is can help. But compare acupuncture. Acupuncture result is much better. This is about this one. Another is called cortical vision impairment. So for this disease, the scalp acupuncture can help. So we can do things. So MS12, MS13, MS1, go blood 20, precardial 6, or kidney 3. For cortical vision impairment, CIV, we can use this treatment. Another call is strabismus. This is called plus eyes. So everybody say the eyes is not closed inside, or is go outside, close inside, go outside. Go outside. Not is on the center. The pupil is not on the center. This is due to the eyes, the muscle is weak. Muscle is weak. So for this, we can use scalp acupuncture treatment. The most, let's see, on the children. on the children. So Western medicine do the surgery is help, but if severe, we can do the surgery. If mild, we can use scalp acupuncture treatment. So one kind of points we see MS 13, MS 12, stomach 1, stomach 2, 鱼腰 UB1, UB2. Because this is a stomach weak, sometimes we need to try to tonify the qi. So make the qi stronger. Make the qi stronger. So make qi stronger, the muscles stronger. Muscles stronger have the power because eyes have 6 muscles. So they can make you pupil on the center. Once the power is this, it's go side. Look like a facial paralysis. Your paralysis, the face don't have power. So then you move to another side. Your pupil, so the muscle don't have enough power. So Macy's use scalp acupuncture treat is good. It's good. But for the children, treatment time may be later longer. Maybe later longer. This is about MS 13. So puncture, how to do? So puncture is usually from the up go down. The up go down. Do half turn to 1 turn. Half turn to 1 turn. Okay, we take 10 minutes break. Take 10 minutes break. Then we continue. Thank you, everybody.
Okay, guys, we'll be back at 10:45.
Yeah, 10:45.
Recording stopped.